Hello! Today we'll explore the principles of carboxy therapy and learn how to operate the CarboMed Bluetooth device. Non-invasive carboxy therapy is a comprehensive treatment system designed to restore tissue respiration and vital skin cell functions, based on the transdermal delivery of molecular CO2 without needles. Carboxy therapy aims to saturate skin cells with carbon dioxide, triggering natural skin rejuvenation processes. Indications for the treatment: normalizing skin tone and texture, achieving a lifting effect, combating photoaging and biological skin aging, preventing breakouts and post-inflammatory hyperpigmentation, PIH, epithelial recovery after aggressive treatments, managing cuperose and vascular lesions, improving muscle fiber elasticity, treating loss of skin turgor and ptosis, reducing puffiness, as well as minimizing the number and depth of wrinkles. Contraindications for the treatment: acute inflammatory skin conditions, active pustules, unhealed wounds, hyperthermia due to infections or colds, pregnancy and lactation, diagnosed oncological conditions, and allergic reactions to the active ingredients. The treatment works by altering blood flow intensity, cell proliferation, and immune responses, which reduces inflammation, boosts microcirculation in blood and lymphatic vessels, oxygenates cells and tissues, and accelerates the synthesis of the extracellular matrix, ECM. The session enhances the skin's moisture retention capacity, thereby slowing down premature aging and strengthening the cellular barrier function. Carboxy effects: improvement of skin quality and structure, nourishment, deep hydration, depuffing, evening out the skin tone, anti-inflammatory action, and boosting metabolic processes. The 3 steps of the carboxy therapy protocol. Step 1. Selecting and applying the activator gel. The choice of gel depends on the client's skin condition and needs. Restore activator gel, formulated with lactic and citric acids, used for an even, comfortable facial peel, hydrates and nourishes, gives the skin a fresh, healthy glow, visibly reduces fine lines, delivers both immediate and long-lasting treatment results. Bright Activator Gel features an acid complex, AHA/BHA, specifically lactic, citric, and salicylic acids, along with vitamins A, E, and C. This gel is used for a gentle facial peel, rejuvenation, brightening, and tone evening, redefines hyperpigmentation while hydrating and nourishing the skin, delivers instant and long-term treatment results. Thanks to the citric acid in the gel and the CO2-generating components, the handpiece with the bicarbonate capsule glides smoothly over the skin, activating the capsule's ingredients. Step 2. Applying the sodium bicarbonate carbon powder capsule. When the sodium bicarbonate capsule and the treatment gel, packed with citric acid, natural botanicals, and nutrients, make contact, a chemical reaction known as the foaming effect occurs on the skin's surface, generating CO2. Thanks to the gel's protective barrier, the carbon dioxide builds up on the skin's surface and penetrates into the deeper layers of the epidermis via passive diffusion. As a result of the local CO2 spike, the tissue pH drops, which triggers the Bohr effect, meaning blood hemoglobin begins releasing more oxygen to the tissues. This leads to a boost in blood circulation, accelerating collagen and elastin synthesis, as well as tissue regeneration. Step 3. Vibromassage. To maximize the carboxy therapy effects, a vibromassage technique is applied using a special attachment. The massage targets subcutaneous fat, lymphatic vessels, and muscles. It also boosts the efficacy of skincare products, helping their active ingredients absorb and synthesize faster into the cells. The handpiece is moved using light, non-dragging longitudinal, circular, or sinusoidal motions. Use gliding or rubbing strokes, maintaining skin contact with intermittent or continuous vibration without applying active pressure. Treatment duration is between 5 to 15 minutes. Treatment protocol. Before the session, perform a double cleanse and remove makeup using a cleanser suited for the client's skin type. If needed, a deep cleanse can also be done using a gommage, scrub, or a mild enzyme peel. Next, we move on to the 3 steps of the treatment: activator gel, bicarbonate capsule, and vibro massage. Apply a thick, even layer of gel to the face and neck. Strictly avoid the eye area. Over the gel, begin working with the capsule handpiece, pressing it firmly against the skin. Perform the treatment using circular motions and even passes over each treated area. Ensure there's enough gel on the skin, as the even generation of CO2 depends on it. After 10 to 30 minutes, once the CO2 reaction is complete, remove any remaining gel with a warm, damp cleansing cloth. Do not exceed a 30-minute treatment time. Wipe the face with a lotion or toner and apply a moisturizer tailored to the skin type. Next, to boost efficacy, perform a vibro massage using the dedicated attachment. Carboxy therapy can be performed as a standalone flash treatment or as a course of 4 to 10 sessions, spaced 7 to 14 days apart. Strict disinfection is mandatory after every use. The handpiece should be wiped down with non-corrosive, medical-grade disinfectants. A 20% chlorhexidine solution is approved for disinfection. Contact time is 5 minutes. Do not use disinfectants containing chlorine components. To clean and sanitize the vibro massage attachment, first wipe it with a soft sponge and soapy water. Then treat it with a chlorhexidine solution. The interface displays the intensity, treatment time, and total operating time in minutes. There's also a start button to power on and an LED button for illumination. The treatment timer ranges from 10 to 30 minutes. We adjust it using the plus and minus buttons. Intensity is customized based on the client's comfort level. They should feel a light, comfortable tingling sensation and vibration. Treatment protocol. We begin with cleansing and makeup removal. Select the cleanser according to the skin type. Apply a thick layer of gel to the facial skin. Attach the sodium bicarbonate capsule to the CarboMed Bluetooth handpiece. Over the gel, start gliding the handpiece in circular, sinusoidal motions until the foaming effect appears. Ensure you have enough gel slip to allow the CO2 to accumulate properly. After 10 to 30 minutes, once the CO2 reaction stops, remove the remaining gel with a damp cloth. Next, We move on to step 3, the vibro massage. We perform the vibro massage. This can be done for 5 to 15 minutes. Once the vibro massage is complete, we wrap up the protocol by applying an SPF cream. If you have any further questions, feel free to ask us on social media. See you next time. Thank you.